Mark. This time of year is especially difficult for babies because of something called RSV. Health reporter Alicia Booth is here now with a look at what parents and grandparents should know about this.
And there's a lot to know about this. What is so difficult about respiratory syncytial virus is that it can range from being like a little cold to a life-threatening illness. Because it's a virus, RSV is also very difficult to treat. Our best defense is to try to keep it from spreading. Little Jake got kind of a rough start in life, having just spent 5 days on a ventilator at Akron Children's Hospital. At just 6 weeks old, he caught something that goes around this time of year every year, respiratory syncytial virus, or RSV.
It's very scary. He's choking and gagging and not breathing.
Jake's mom, Beth, is amazed at how quickly he went downhill.
He went from, he's got RSV, keep an eye on him, to he's in trouble, you need to get taken care of now. And it went fast.
As a preemie, less than 6 months old, Jake is in the high-risk group for this highly contagious infection.
Admitting onto the floors at least 10 kids a day with RSV, and we've been getting a couple kids every day into the intensive care unit.
Pediatric intensivist James Basunder says the infection affects the airways of the lungs. RSV can range from a little cold to a life-threatening illness. The virus is spread by droplets, sneezing and coughing, and it lives for a while on surfaces and your hands.
And then you go and touch someone else, and then now they have it on their hands. They put their hands up near their mouth or nose, and now they get infected with RSV.
Among other symptoms, look for difficulty breathing and/or a lack of appetite, and don't delay getting medical attention. Beth is glad to be through the worst of it with Jake, in a place that eased her fears.
The nursing staff, the respiratory therapists, the doctors, everybody, they're wonderful.
Now, kids who have had RSV are also at a higher risk for developing asthma, and Dr. Basunder says that it is especially important that parents do not smoke. If you want a better idea of when it's time to go to the doctor, we have a list of symptoms for you online on newsnet5.com right now. And RSV usually peaks in February and March, and hand washing so crucial for parents, especially older siblings in a home with the newborns.
Right, really scary for those little babies, and I guess tough to treat because it's a virus.
It is, and as you know, my daughter was in the hospital for 5 days a couple years ago with this, and it's very frustrating because they can do breathing treatments and things like that, but they don't really help. It's mostly just try to make them as comfortable as possible, and as a parent, you feel good being in a situation where you are surrounded by people who know what they're doing.
But need to respond to those symptoms quickly.
Yes, you do.
Okay, thanks, Alicia.